On MorningLine, thanks for joining us on this Tuesday. We are talking about pain, opioid addiction, treatment, and how you deal with it. Dr. Tracy Jackson's with us from over at Vanderbilt University. Nice to have you on. Thanks for coming on. It's a good topic, one we've talked about several times on the show in the past, but maybe there's some new ground being broken thanks to doctors like her. Let's go to Monique next. Monique, good morning.
Good morning.
Hi, Monique. How can we help you?
My question is this. First, I really like what Dr. Jackson?
Yes.
is saying. There are very, very many alternative options to pain management. I'm a patient at Vanderbilt, 6 back surgeries, 3 shoulder surgeries.
Wow.
I don't take opiates. I refuse them. How can we get them off the streets is my question. Son, 22, addicted to opiates, spent a year in rehab, ended up injecting heroin. He does not have pain problems. How do we get the opiates off the street? And another alternative, for me, I take Mobic, I've taken gabapentin, Aleve, and physical therapy. I've had a total of 9 surgeries.
And is that working for, so you are taking some medicines, but are you also then the physical therapy and are you doing any of the cognitive treatment, trying to train yourself to deal with it?
Yep, exactly.
And it's working for you?
Yes.
Fantastic.
But my question is, how do we get these opiates off the street?
And and I don't know if that's the answer to seek from you. I mean, you may have a thought on that, but I mean, that's law enforcement, lawmakers, everything.
All of that. And you're exactly right. 1 in 5 teens have used pain pills recreationally. And they're largely taken from the medicine cabinets of friends and family members who were prescribed them for pain. And so it again has to be a multi-pronged approach. Yes, it's law enforcement. Some of it is education in schools about what these opioids will do. A lot of people think, oh, it's just a pain pill. How is this going to be a problem for me longer? And so they don't realize that they'll be addicted. So education earlier in schools. Some of it is educating doctors to prescribe less pain pills. I used to be a general surgery resident, and when somebody had an appendectomy, I would just write 100 Percocet because I didn't want them to call in the middle of the night. You know, if they ran out, I wanted them to have enough. And now we see that that practice is doing nothing but putting more pills on the street. So some of it is education of doctors, education of kids before they're exposed to these opioids, and again, having new non-opioid strategies available to patients.
It's nice to hear from someone who says it's working for her. Let's go to Trish. Hi, Trish.
Hello.
Go ahead, Trish.
I wanted to ask, or kind of comment to the doctor, ask her opinion. I've had, surgeries to fix problems, and I've done physical therapy to fix problems for pain, and they've worked. But now that I'm diagnosed with pancreatitis, it's become a whole different ball game because although I do take Creon in order to eat, just eating food will cause pain. Not every time, but sometimes. So are there any situations with pancreatitis that, like you were talking about, like physical therapy or some other options that could be done other than, say, a pain pill? Or I've been dealing with it for about 6 months, and my doctor, I feel, is very caring, but it's a very confusing disease, and I do not drink alcohol.
Okay. What do you think?
Yeah, and so with any pain condition, there are really only 4 ways to treat it. There are medications, there are procedures, there are rehabilitative therapies like physical therapy, and there are the cognitive strategies we talked about. There really are always options for the latter 2, for cognitive therapies and rehabilitative therapies. Even if it doesn't directly address or change your pancreatitis per se, or whatever the cause of your pain, it can reduce the amount of pain. It can reduce your pain experience based on doing these things by having movement and mindfulness involved in your care. And the other thing is there may be procedures that could be useful for your pancreatitis that a board-certified pain physician could do for you. And there are non-opioid medications that may be useful as well. And so with every option, if you're not really addressing, with every pain condition, if you're not really addressing all 4 of those options, then you're not doing everything that you can, or your doctor's not.
Right. And when you said non-opioid, you said there are the others types, I think we were talking during the break, they go on a different pathway. They're more focused on the nerves, did you say?
Yeah, so they're focused on different chemicals that are involved in pain processing.
And are they not as addicting?
Correct.
Oh.
That is correct.
Well, why not just go that way?
Well, the perception, again, is that opioids are stronger, and opioids are the pain pills.
Right.
So, and these other ones are not pain. They're not really. The perception is that they're not really as strong or as useful, which is not true. There are many conditions where those pills would be much more effective than opioids for management of your pain.
So what we're fighting here is kind of over time, it's taken on, I don't know, just a persona of its own, pain pills.
Right.
And that's just what people think. And we have to fight that. Society looks at it that way, even though there's new treatments, and they're just not going to let go of it that easy.
Right. I mean, I think some of it, like I said, is education of providers, education of patients, education of everyone. And so that's why public advocacy and spreading the word about this is really important, because every voice does count.
Let's go to Steve. Steve, go ahead. Hi, Steve.
Hey, good morning.
Morning.
I'm a chronic pain patient and have been for about 8.5, 9 years now. Started off as a surgical assistant in the operating room, ended up hurting my back, and now I'm on quite a bit of pain medication every day just for a quality of life. But being a chronic pain patient, we have a stigma that we have to get by, that we're all drug seekers.
Right. Well, and that's not fair. I mean, obviously, you have chronic pain. I mean, you're just trying to get some relief.
Right. I'm trying to get some relief, but I went through an interesting episode of some therapy.
And did it work?
You know what? It did work. It taught me that no matter how much pain medication I'm on, I'm going to be hurting every day. So my thing is to learn to accept that pain that I'm on a daily basis, but get augmented relief with the narcotic, because it does give me a quality of life that otherwise I would not have.
Okay. Okay.
And,
interesting.
Thank you for calling in. And I agree that there are patients that are doing very well and are highly functional and have quality of life when they are on opioids. And the opioid prescribing guidelines are meant to allow physicians to still prescribe those medications with safeguards. But for everyone, for physicians and for patients, I say again, if you're not using all 4 of those limbs, the psychological aspect, the rehabilitative aspect, potentially procedural, and the pills, then you're really not doing everything that you potentially can to minimize opioids. And opioids do have side effects long term, even if they're making you function, can affect sexual function, switch the way your body actually processes pain, and cause something called hyperalgesia, so you have the capacity to feel more pain in the future. And they can mess with your mood and sleep, all that stuff. So anything you can do to potentially minimize those medications is good. The second thing I wanted to say, what you said about therapy, I also mentioned in the TED Talk, which is that what happens, if you haven't been to the gym for a year and then you go, physical therapy always hurts worse when you first get started.
Just starting back into
but especially, most people with chronic pain don't want to move because it hurts. But using cognitive strategies like learning to pace and working slowly towards incorporating specific stretching and strengthening, specific therapeutic movement into your daily life will improve pain and reduce your need for opioids in the long term.
What was interesting about what he said is, in some of the therapy, it sounds like he was told or has come to the conclusion he needs to learn to just accept that he's going to be feeling pain the rest of his life.
Yeah. And I'll say that this is something I try to be very honest about. 30% of people the world over experience chronic pain, whether you're living in a grass hut or in a skyscraper. And there may be some pain that we cannot take totally away, but if you ask anybody with chronic pain, they don't expect zero pain. They just want quality of life. They know they're going to always potentially have some pain. But what I don't think they have to accept is they'll have to be on opioids the rest of their life. That does not naturally follow.
Gotcha. Let's take a break on that note. Back with our final segment with our guest. More of your calls right after this.